Stacy.
Hi, Dr. McGarry.
Thanks for coming in. So again, I'm Dr. McGarry, and I'm going to be your provider for this. And so today is really just to get to know you, Daisy. This is a chance for us to learn a little bit about what we're doing here with Brief Cognitive Behavioral Therapy for Chronic Pain. Have you ever had BCBT, CP before?
No.
Yeah. So I'll tell you a little bit about it, and then we'll start just by setting a quick goal so we can get a sense of what we're working toward. Does that sound good?
Yeah.
Okay, so I'll give you an explanation. Feel free to stop me anytime you have any questions.
Okay.
So brief cognitive behavioral therapy for chronic pain usually involves about 3 30-minute appointments, although some people require more, some people actually require less. So it can be tailored to each individual person in terms of what you do. We have individual modules. If you agree to move forward with this, and this is up to you, then I ask that you commit to trying 3. Just to make sure that we get you enough of the treatment for you to be able to get a chance to see if it works for you. Some people may need up to a total of 7, which is the most that we have to offer. We can include additional modules if we want to, and each time you and I meet, there will be a new pain management skill that we'll practice, but we'll also talk about practice from last time we met as well. So our first 2 modules, and we have a manual for you to look through so you can follow along. Our first 2 modules include background information about what chronic pain is, along with setting goals, which we talked about a little bit earlier, we'll do in a second. And then we'll follow that usually with some brief relaxation training together. And we use relaxation exercises because these have been shown to work for most people who experience chronic pain. So it's a great place for us to start. We'll decide together from there which topics we want to cover. So it will always be a decision that you and I make together. And we may choose activity planning and pacing, that's one option. So activity pacing is really how do you make sure you're able to do things that are meaningful to you, but not push yourself so hard that it makes your pain flare up or get worse. We also might move on to advanced relaxation training. So if you try the relaxation today and you really like it, there are more advanced versions of that we can try that may be even more effective. So we could do those too. We could look at cognitive coping. This is a way of helping address unhelpful thoughts about pain. Sometimes when we experience pain a lot, we start to think about pain in ways that aren't necessarily helpful for us in terms of doing the things that we want to do throughout the day. And so this is a chance for us to look at those and try to make your thinking more realistic. Then we also have modules looking at other skills, including sleep, grief and loss, topics like that. So at the end of each module, we'll talk about ways that you can practice each skill. You'll also have worksheets that will help guide that practice for you at home. And of course, I'll always be here to answer any questions that you might have. So do you have questions so far?
No questions, Dr. McGarry.
Okay, great. Well then, why don't we jump right into talking about goals? I want to make sure that as you do this, that we're working on goals that are important to you. So can you give me a sense of what you're hoping to get out of this treatment? What kind of goals are you hoping to pursue?
When I start experiencing my lower back pain, I just kind of give up the rest of the day.
Yeah,
I
and when you say give up, you don't do anything? Yeah.
I just lay in bed for the rest of the day.
What kinds of things are you giving up when you give up the rest of your day?
Normally on the weekends, that's when I would used to like go on dates with my husband, but we don't. After I'm done working for those 3-4 hours, I'm done for the day.
Yeah, and it sounds like not being able to go on dates with your husband is something that's disappointing for you.
Yeah.
So maybe that could be a goal we could set, is working towards helping you get to a point where you're managing your pain well enough to go on dates with your husband.
Yes.
And so when we do this, when we set goals, we usually follow a framework that we call SMART goal setting. Have you ever heard of that before?
No.
That's just a way of making sure that we build out a goal that we can definitely pursue and set ourselves up for success. And the first means that we want to be specific. So being specific means when we say go out with your husband, what's a specific way of going on a date with your husband that you would find valuable?
We normally like to go to the movies, but that hurts my back.
Okay, so going to the movies hurts your back. Is it going to the movies and sitting there at all going to be beneficial, or do you want to be able to watch the entire movie?
I would like to watch the entire movie, but if we could start small, I'm okay with it.
Even starting small would be okay, great. Yeah, see, we want to just make sure that we are very specific about what we're trying to accomplish so I can help you work towards that.
Okay.
We'll look at one more component of this, but we'll have more time to talk about SMART goal setting the next time we meet. So the last is we want to make sure that we track whatever goal we set.
Okay.
So what would be a good way of tracking the time you spend watching movies with your husband?
I could put a timer.
So we could set a timer and maybe count the number of minutes. That's great. So all of this treatment is built around making sure that we hope you develop the skills that help us move towards these goals. And you gave me a really great example of a goal that you want to set, a specific goal you want to set of going to the movies with your husband. We're going to track that by monitoring the number of minutes, and we'll use the different coping resources that we learn together to help you get there. Does that sound good?
Yes.
All right, well, it's great working with you. I'm excited to work on this, and hopefully we'll get a lot out of it.
Thank you, Dr. McKinney.
All right, my pleasure.